Good morning, everyone. We are all set now. We'll go ahead and get started. Welcome to today's, the final day in the week-long 2024 Presidential Symposium here at Hofstra University, focused on higher education in an election year. It's great to see so many students and others and visitors and members of the community here this morning. My name is Charlie Reardon. I have the privilege of serving as provost here at Hofstra University, and so I'll just make a few brief introductory remarks and then turn the panel over to the moderator. And we have a great set of panelists before you today. So as I have done at the other sessions throughout the week, I want to start most importantly to thank and acknowledge those who have contributed significantly to the development of the program over the last number of days and its flawless, and I mean that sincerely, flawless execution. So first, to the faculty, the members of our staff and administration, and the outside guests who have served as panelists throughout the last 3 days. I want to thank each and every one of them. All of the conversations have been remarkably engaging and just a diverse set of topics and perspectives that really, I think, serve to remind how important our democracy is and how elections really touch on every aspect of our lives as individuals. In a presidential year, we often think about the top of the ticket, and there's a lot of conversation about that, and we've had very interesting discussions about that. But as has been said a number of times in the last couple of days, all politics are local, and so things that are happening on the very local level have a huge impact for us. I will also remind anyone who is registered to vote in Nassau County will have the opportunity to vote on campus when early voting starts October 26th, I believe is the correct date for that. So in addition to the faculty, the administrators, and the staff who have really contributed to the panels throughout the week, I want to acknowledge the fantastic team at the Hofstra Cultural Center. So Athleen, Carol, and Janine, they've really become sort of, you know, the first name only. All you need to say is Athleen, Carol, and Janine, and you know who you were talking about. But we should really give them a round of applause for some great. Okay, Athleen, Beyonce, you know, that's all we need, just one word. I also want to take this opportunity to acknowledge the two faculty members who have taken a lot of time over the summer and through the fall in the last several days and have attended all of the sessions. Those are the two faculty who served as co-chairs for this year's Presidential Symposium. So first we have Mina Bose, who's a professor of political science and the Peter S. Calico Chair in Presidential Studies in our Hofstra College of Liberal Arts and Sciences, and then Christina Wu, who's an associate professor in media studies in the Lawrence Herbert School of Communication. So both Mina and Christina, please stand and be recognized. Thank you for that. And as I've also been doing, I want to draw your attention to this afternoon's final presentation in the Presidential Symposium, which is the keynote address, which is going to be presented by Lily Mason, who's the SNF Agora Institute Associate Professor of Political Science at Johns Hopkins University. Had the pleasure of sitting next to Professor Mason at dinner last night, and I can say unequivocally that her presentation is going to be incredibly engaging, very data-rich, and so I encourage all of you to attend. That presentation is at 2:40 p.m., and it's over in the theater in the Student Center. So you just go across the Unispan, don't have to get wet at all in the rain, and we'll see you all there at 2:40. So today we're going to kick off this morning's session with a panel entitled State and National Legislation to Enhance Mental Health Services on College Campuses, the Impact for the Upcoming 2024 Presidential Election. So this panel is really focused on the current state of student mental health at universities, along with the consideration of state legislation to strengthen service provisions, as well as national efforts by Congress to expand treatment and treatment options. So to kick this panel off, it's my pleasure to introduce Joel Brown, who is an assistant professor of counseling and mental health professions here in our School of Health Sciences. Joel.
Good afternoon, morning. We're still morning? We're still morning. Good morning, folks. Thank you all for joining us despite the weather, the heat, whatever's kind of influencing your perhaps comfort in the moment. I want to just first thank the School of Health Sciences and collaborating departments, university members for sponsoring, facilitating this talk. I will kick us off with a few words and then turn the conversation over to my panelists. So hopefully you're able to see the slide. I think we're still connected. Very good. Elections have always shaped the national psyche of our constituents, but today's hyper-partisan environment, coupled with social media, has magnified the emotional and mental toll that these political moments take on young people. Data from the 2024 Healthy Minds study revealed that while a slight drop in students who report experiencing depressive symptoms has been noted, compared to the previous year, dropping from 41% to 38%, notable concerns remain. College students, many of whom are voting for the first time, experience amplified anxiety due to their frightened political engagement and awareness of how election outcomes affect issues that directly impact their future, such as healthcare, education, and climate change. The 2024 election is no different. As college students grapple with key issues, student loan forgiveness, reproductive rights, and mental health policy, they find themselves caught in the crosshairs of another difficult election cycle rife with uncertainty. A 2021 survey by the Jed Foundation revealed that 68% of students reported heightened anxiety about the future of the country, making the upcoming election a significant factor in their mental well-being. Federal legislation has always had significant impacts on the outcomes of students' well-being. Notable legislation like the Higher Education, Affordable Care, and Mental Health Parity Acts have notable influences on the experiences of college students. For example, the Affordable Care Act has made an impact on access to services, making it easier for college students to obtain mental health services by allowing them to stay on their parents' insurance plans until age 26. Without this provision, many students would be forced to go without adequate health care coverage. A study by the Commonwealth Fund showed that after ACA's implementation, insurance coverage among young adults aged 18 to 25 increased by 7% between 2010 and 2016. And there was an associated 14% increase in mental health services utilization among this group. The Mental Health Parity and Addiction Equity Act, which mandates that insurance coverage for mental health and substance use disorders must be no more restrictive than coverage for physical health conditions, was passed in 2008. Its enforcement, however, remains a work in progress, as ongoing challenges exist in ensuring that students receive equitable access to mental health care. A 2022 survey found that about 40% of students with insurance still report difficulty accessing mental health services. State legislation, New York State that is, has also had a significant impact on mental health service delivery. Influential pieces of legislation like the New York SAFE Act in 2013, the Suicide Prevention legislation in 2019, and affiliated legislation, and the Post-Secondary Mental Health Services Act in 2021 have all made impressions on existing access and treatment considerations related to and available for college students. Enhancements to legislation, such as those within the New York Mental Health Parity Law, also known as Timothy's Law, mirrors the Federal Mental Health Parity Act, but goes further by requiring insurers to provide coverage for all mental illnesses, not just those that are biologically based. Consequently, New York's Office of Mental Health has reported a 20% increase in mental health service utilization among young adults after this law went into effect. There are still challenges, however, and opportunities. Despite legislative efforts, significant gaps remain. According to a 2023 survey from the National Alliance on Mental Illness, 60% of college students in New York State who sought mental health services reported long wait times to see a counselor, and 40% said they felt that the quality of the care was inadequate. There's also the challenge of funding. While state and federal laws mandate parity and access, the actual delivery of services often depends on the availability of funds and resources, which can be uneven across different campuses. At the same time, new opportunities are emerging. The proposed Student Mental Health Initiative, part of the New York's 2023 budget proposal, included a $33 million fund to expand mental health services at public colleges and universities. This could provide much needed resources for hiring more counselors, reducing wait times, and creating programs that address specific student needs, including crisis intervention and peer support networks. As an additional backdrop, political influences have always had and continue to influence factors regarding today's discussion. The Democratic Party has long prioritized healthcare reform, with mental health as a key component. As previously mentioned, the Affordable Care Act passed under President Obama, as mentioned earlier, significantly expanded access to mental health services by allowing young adults to remain on their parents' insurance plans until age 26. Democrats have also advocated for increased federal funding for mental health services on college campuses. For example, the 2020 Biden-Harris campaign included proposals to fund additional mental health professionals and support for mental health crisis response teams. Proposals to cancel student loan debt have also been linked to improve mental health outcomes, as student loan debt has long been a significant driver of stress among college students. The Republican Party has historically favored a more limited role for federal government in healthcare, including mental health. However, in recent years, the GOP has acknowledged the importance of mental health reform, focusing on state and local solutions rather than large-scale federal programs. For example, under the Trump administration, the passage of the Support for Patients and Communities Act in 2018 targeted the opioid crisis and included provisions to improve mental health services for individuals struggling with addiction. Historically, Republicans tend to emphasize individual responsibility and community-based interventions. Rather than expanding on federal health care programs like the ACA, generally Republicans advocate for private sector solutions and state-level control over healthcare services. In the context of mental health specifically, this often means prioritizing targeted interventions, such as expanding school-based mental health treatment programs and supporting veterans' mental health. It has now perhaps more than ever been acutely apparent that college students are particularly sensitive to how elections shape national policies that impact their immediate and long-term futures. Again, key issues such as student debt relief, reproductive rights, and climate change are closely tied to their mental health. As you listen to the information shared by today's assortment of mental health experts and student advocates, we invite you to take note of your reactions and your questions, holding them until the Q&A that follows, as we've curated time specifically for dialogue. I'd like to now turn over our attention to the first presenter, Dr. Laura L. Brader, the Assistant Vice President of Behavioral Health and Director of the College of Mental Health Partnership, perhaps in collaboration with Dr. Mary E. McKay Noble. Folks? We can try and see what happens.
It looks pretty, So while you guys do that, I'll just talk about, I'm just going to ground us in who we are. So I am the Assistant Vice President of College Mental Health at Northwell. I happen to work with college students every day. We connect. Do you need this lower for me? That's not new to me.
We're good. We're the same height.
Okay, so I'm the Assistant Vice President of College Mental Health, and I work with college students every day. I started a program, I'm a psychologist. I started a program at Northwell about 15 years ago that focuses on acute mental illness and the college population. So it's a small subset, but a much needed subset of the college mental health population. And Mary and Dr. McVeigh and I are going to present together on this. It's a real treat, and I'm going to get your title wrong, so I'm going to let you do it.
The treat is mine. Laura and I have known each other for a very long time. And she's a dear friend and colleague. I am the Executive Director of Student Counseling Services here at Hofstra. And so we have a partnership as individuals in our field, and we also have a partnership as professionals. And it's our pleasure. Thank you so much for inviting us to speak to you about something for which we have an incredible shared passion and a driving mission, and that is addressing the mental health needs of college students at different levels, me at the university level and Laura at a greater institutional level for Northwell Healthcare.
Great.
So we're going to do this together in tandem because that's kind of how we do everything. Really, our goal is to talk about how we're going to support college student mental health, the impact of elections on college student mental health. We'll be presenting some findings. Please forgive my slides. It said repair. It broke when we put it in. But really, we did this without slides and provided slides so that you could see a little bit of research and background. But really what we're going to be talking to you about is the state of college student mental health, the impact of elections, and what universities and greater institutions can do at our level and also at a greater governmental level to support college student mental health in election years. So college students in general are struggling more than they ever have before, and I think Laura knows this because she runs the Behavioral Health College Partnership at Northwell, and that's a dedicated college student mental health unit. It's an incredible resource, and it's a one of a kind at this point. I've been in college student counseling, right, at the Counseling Center at Hofstra University for 17 years, and what we've really seen is a tremendous shift, but it's not here, it's nationally. And I would argue probably worldwide. We know that, according to the National Health College Association research, 30% of students are talking about the fact that they're experiencing academic impairment as a result of anxiety. Now, if we were having this conversation 20 years ago or even 15 years ago, we'd be looking at depression as the #1 issue. And it isn't anymore. It's shifted to anxiety. And this is a primary mental health issue affecting college students today. It's the #1. Depression is in the mix, but anxiety seems to be at the fore. And I think, Dr. Brader can speak to that as well. I think on your units, you're seeing a lot of anxiety in addition to depression. And it's not like one happens in the absence of the other. They can happen together.
It's interesting because I think that the primary diagnosis on our unit is not anxiety, but a lot of times it presents first as anxiety. Right. So we'll see, it tends to happen that somebody is anxious, and this is going to really dovetail into her findings later, that somebody will be anxious. They will start to avoid, they will start to retreat, maybe not socialize as much, not go to classes, maybe not be able to engage in their academics. And then there's a decompensation to be more major depression, have more suicidal type thoughts, or, on our unit we also do have bipolar and psychosis, but those are more necessarily organic mental illnesses that will be more stable over time. So I'll let you finish there.
No, that's fine. In fact, anxiety can be a precursor. It can sort of indicate a rising tide of just poor mental health, or it may be an anxiety disorder all by itself. It's just something we, see all the time. So really, the impact of mental health issues on college students can be profound, and it's only increasing. In 1995, there's a study that's documented all the time that about 5% of college students left their educational careers as a result of mental health issues. In 2024, Sallie Mae research, actually, because they have more access to more people, indicates that now about 18% of students are citing mental health reasons as the primary reason that they attrited from their academic programs. That's a huge increase, and that's something we have to be aware of. So when we talk about really the measured impact, and this was, as we were preparing this conversation, in collaboration with, our panel, our focus was really on what we do, and that is college student mental health, but it's impacted so profoundly by sociopolitical influences, geopolitical influences, and obviously if a student is already struggling, a more stressful, less certain world environment is going to have an impact. But there is research on both sides of this, but what we really want to do, and I want Laura to talk about what she does best and what she sees, and then I'll talk about what I see, but we always talk about data too. There's a longitudinal study that we're going to refer to that was done between 2006 and 2000 and 2016. It's a long time, and it focused on election years, but it was done at one large institution in the Midwest and at more than 100 other institutions across the country, and it's counseling center data. So we can talk about that, and then we can also talk about what Dr. Brader sees on a college student inpatient unit.
On the more acute level. Yeah.
Exactly, at a more acute level. So when we look at this data, we really see across those 16 years, particularly measuring overall mental health, it says the results didn't support findings that presidential elections negatively impacted the mental health outcomes of students who received university counseling services. This is a self-selecting group. These are people who are taking care of their mental health, who are talking about their emotions, their cognitions, and their actions. And so I want everybody to think about that. So there's a buffer. Even in very stressful times, when we are coping, when we're engaging resources to cope more effectively, we do better, and we are able to tolerate shifts, changes, disappointments, and anything that the world throws at us, and that's what I would kind of encourage us to focus on. There's some competing research done in 2019 by Roche et al. That suggests there's this diary study that they did. They collected daily diary of thoughts and emotions of students around the 2016 election that did show spikes immediately around the election and sleep difficulties and stress and reporting intense anxiety, followed by anger, etc., right after the election. However, that dissipated quickly. And again, that's the thing to remember. We're going to have a lot of thoughts and feelings about this, but it is possible for us to make it through that, especially with coping and intervention.
So it's interesting because I've heard this data, and at the hospital, we connect with 96 schools. So when a student is either suicidal, homicidal, or psychotic, they are transferred to us. We do an assessment, and we have an inpatient unit that is completely for college students. And during election years, I kind of batten down the hatches. We sort of brace ourselves. And when Mary and I were discussing this data, I'm like, this isn't quite ringing true for us. And, and I think that it's really interesting because our numbers post election years typically goes up about 30%. In hospitalizations. That's a decent number for a regional program. We hospitalize typically around 700 students a year, and that typically goes up around 30% during an election year. Here's what I will tell you. Almost never is that student completely healthy and then approaching an election year decompensates. Typically, there is an underlying problem that is not being taken care of, or not being addressed, or not identified, or they're not able to verbalize. They haven't received help. And then there's an additional trigger that may lead to a student feeling like they're unable to cope. And there's many different triggers that can do that. There can be midterms and finals are a very busy time for me. Valentine's Day is a very big time for me. There's other times where we see these bumps. We don't tend to see them in the summer months. I will tell you that most of these students that do teeter and do end up needing to be hospitalized get a diagnosis. They are given treatment, and the majority of them really do go on to live happy, healthy lives. Now, I am not in any way suggesting that we want that to happen and that we want but I am not looking for more business at the hospital. That is for sure. But what I am saying is we can prevent a lot by identifying things before we hit the moment where we can't take it anymore, and utilizing your student counseling centers. And I deal with 96 student counseling centers across the New York area. She is my friend, I have to say. I do like working with her. And Hofstra has traditionally had a very evidence-based gold standard program. So I think it's really important to utilize the resources we have and to lean in and to have productive conversations with our peers about it, as opposed to sometimes isolating or putting off getting help.
And I think that that's really the message that we're trying to promote most solidly, is what we can do as communities, because universities are communities, and they're places where you're actually, if you are a college student, you are likely to experience fewer adverse events and to have more support if you are experiencing adverse events than in the general community for students or for people of the same age. So at colleges, you have greater access to resources and greater support to mitigate anything that's going on.
Is this where you want me to talk about leading into the narrative?
Right on the end of this.
Okay.
So Dean Austin asked us a great question. What can institutions of higher education do to support students during elections? But it's part of our greater question, what can we do to support all of our students all of the time? And that's what we're doing. I think we as an institution at all levels, faculty, administration, every single person on this campus can model civil discourse, teach it and encourage it. So I think we don't see it out in the world all the time. We don't see it on Twitter or X. We don't see it on Instagram. We don't see it on TikTok. But it is possible to engage in civil discourse and to hear other people's views, to express our own effectively, and in a way that allows for the dialectic, for the both and. We can create those environments of respect and belonging, and acceptance from multiple viewpoints. Our diversity as a university is what makes us beautiful and incredible and strong. And so working to feel a sense of belonging here, it's not, no individual is responsible to create their own sense of belonging. The university creates the sense of belonging, and individuals find their place, they fit in by expressing themselves, by finding community. We, as educators and administrators, can encourage that dialectical thinking and flexibility. We can get so dogmatic, we can get so rigid, and that does not improve our sense of community or mutual respect in any way. And so really thinking about what can I do, how can I be part of the solution, and how can we create that from a top-down, greater institutional level? We can structure appropriate forms for self-expression and gathering, and that's really something that Hofstra leans into. I have to say, as I was looking at what would be effective on a national level, I'm so proud of our institution because we are doing this here. Our students, you, our faculty, you're experiencing this here. And that sense of shared community that we all belong here and we all take care of this and each other is very powerful. And I don't know that that's existing at all institutions across the country at the moment. And increasing campus mental health resources. That's a very big deal. And again, be very proud of this institution because they have done that. And we can talk about how they've done that. I can save that for questions. But they have done that so significantly in the last couple of years. It's a privilege to be part of that. And Dr. Brader.
I think I have a comment on just narrative in going into an election year. And I think it's interesting that there's data that supports that college students, there is more anxiety. And there's also data that supports that it is not permanent and it's short term. And that students can ride through anxiety, discomfort, and disappointment. And I think, given that we have, and I'm an advocate for student mental health, and we're going to talk about some of the things that I really would like to see happen. But I think it's also really important to understand at working with college students on a very close level. I have a great respect for how much they know about themselves, how much they know about mental health compared to when I was younger, and also for their ability to advocate for themselves and ask for help. And I think that we have done a very good job of destigmatizing mental health. And at the same time, we also don't want to lean into a constant narrative of mental health crisis. Are there people suffering? Yes. Are there things we need to do to improve it? Absolutely. I also don't want to say that the majority of students in this university are not capable of handling disappointment and a negative outcome, because 50% of people are going to be disappointed if the polls are right. I don't know, whatever it is. I don't know what Hofstra would be. But we want to make sure that regardless of the outcome, we are respectful to everybody. We are able to manage our emotions, that we understand that we have dealt with difficult situations in the past and been disappointed, and we're still here. And I think that narrative is extremely important to not creating a catastrophic type of verbiage that election outcomes will cause serious mental illness, because that data isn't supported. And it does cause stress. Stress does not equal anxiety necessarily, and we don't have to let it. We want to manage our stress. We want to take the onus of our mental health and our ability to control ourselves and advocate for ourselves. And I believe in college students doing that. I see it every day. I am amazed by what college students accomplish in 7 to 10 days on an inpatient unit, and how I see them move on and get better and go on to live really happy, sustainable, healthy lives. But a lot of times there is a feeling of pathologizing an uncomfortable feeling. Stress is uncomfortable. It's uncomfortable to do things sometimes, and we don't have to necessarily call that anxiety and until it becomes what we would call pathological or symptomatic.
Yeah. So I love listening to her talk because she's a wise woman. I think that something so important to remember is that there's a set of things in our lives that we control. That set of things is very small. When we focus on trying to control things that are beyond our scope, we have a really hard time accepting them because we can't control them. Acceptance of reality, no matter what that reality is, helps us. We might feel pain or discomfort or uncertainty because of it. That doesn't mean we can't affect change in the world. It means feel your emotions, experience them, talk them through. Don't let those emotions be a basis for action when you're in emotion mind, right? So the pain or discomfort of uncertainty or a difficult situation or moment in your life or in history is not the reason to take action. Take action by considering facts, looking at your emotions, and going to a place of wisdom, going to that place in the middle where you say, okay, what can I control? Control the controllables. Control what you do, how you speak, how you treat other people, right? Work to create more positive change in that way. And if there's something that's difficult that you don't like, that you can't control, the best thing you can do is work to accept it and control yourself at the same time. And by control yourself, I don't mean be suppressed. I mean, look at what you can manage, look at what you can focus on, look at what you can improve, seek the right help, do what you need to do for you, and be there for others too, right? And that's the tough thing that's difficult to conceptualize in an uncertain situation. And I really like that you said, don't pathologize the discomfort that you feel about an uncertain world situation. It's natural. And if you see it rising to a clinical level where it's causing interference with your ability to engage in activities of daily living, then seek help. That's the control you have.
Am I on the last one? Future trends?
Yeah.
Okay. Future trends. Okay.
Some favorites. Start with yours.
Okay, my favorite. I'm a little self-serving in this, coming from Northwell and working for a large hospital system. But I think the Hofstra administration will agree with this. I do not believe that 100% of the onus on college mental health can remain at the university and college level. It is an enormous undertaking. It's financially unsustainable, and it's just unrealistic. And what I would recommend is a much more bioecological approach. Now, in Northwell, we take a subset of the students that are more acute, and they are treated in a separate institution, ours, on an inpatient unit that's solely college kids, and then we provide their post-acute care. 60% of the visits from a counseling center typically come from about 20% of their students. And those are the students that are struggling, that need more attention. They need to be seen more than 1 or 2 times a week. That's really hard to do in a counseling center when you're caring for everybody. When you have specialized programs, you're focusing on those students, you're prepared for those students, you have specialists in the disorders that emerge during those years and the diagnoses that we see, and we're able to have economies of scale. And honestly, we're the only program of its kind in the country. I don't know how that is after 15 years, because my first year, I was afraid someone was going to steal the idea. And now I'm like, I can't believe no one did. But the thing is I think that's one example of how other institutions can lean into this bioecological approach and help. I also think that government and community has to have a part in this, and other providers. And we need to start disseminating some of this burden on the schools, and not just have people looking to the schools and saying, you need to handle this all, because it is not sustainable for the tuition. I'm in my last year of tuition for my last child. So I know it is not sustainable for tuition for all mental health to be handled under tuition and schools. The second, do you want me to do the bee in my bonnet? I have a bee in my bonnet about something.
Because it's a bee in your bonnet too.
I have for those of you who don't know, it's a saying from the Midwest, but it's basically that I have an idea that's been bothering me, and it is bothering a lot of clinicians regarding student mental health, and it is a government legislation issue. The issue is that licensure for psychologists and psychiatrists and other healthcare workers does not cross state lines. Now, what that means is that when a student, freshman, goes to college, let's say there's a student that's been on a medication for years, has providers for years, they're coming from another state, they come to Hofstra, they have to give up their providers that have their baseline and their background and their knowledge and the mapping of how they operate, which is such valuable information for clinicians. And we have to transfer it and find new providers for that student while they're in the most vulnerable time of their, one of the most vulnerable times of their life. They're transitioning to school without social supports, where no one's going to have a baseline on them and see any aberrant behaviors or behaviors that aren't typical for them. On the flip side, I'll give you another example where I call it fraught with peril, is when we hospitalize students and they're discharged, we provide acute, post-acute care. Multiple times a week, people can be seen. They have different groups. They have individual therapy, medication management. But let's say they're hospitalized in April. They have 3 or 4 weeks of treatment in our team, and then they fly home to Wisconsin. Legally, we are not able to maintain treatment of that student while they're home for 3 months. So now we have to find a provider there that hopefully will specialize in their care, the diagnosis and their care. Give a handoff, hope we can get them up to speed fast enough, and then take the patient back in September. The continuity of care, the fidelity of care is greatly compromised in those situations. And my argument is we did it during the pandemic when we had emergency status. It was taken away from us about 1.5 years ago. Yeah. And it is one of the things that is such a big deterrent and a big obstacle for student mental health, because it's now students that live out of state don't need just one set of providers. They have to have 2 sets of providers. And that is just, I think, even more unrealistic than what we started with. So I don't know, I've had conversations with people, but when we talk about legislature, that's my number 1 plug and request if anybody in this room has any pull.
And I would echo that. The other issue we see, most profoundly at the level of college student mental health is lack of providers. It's very hard to get people on board. We're hiring, and there just aren't people to hire. And so one of the things, there's recent, September 12th bipartisan legislation to support scholarships for individuals in mental health fields so we can boost our number of providers and hire people to take care of people. And that's what we need. We need to be able to take care of each other in a substantive way, both at colleges and universities, but also across all sectors of society. And we have a provider shortage. Universities that are aware and provide responsive as opposed to reactive care. So if they're aware of the trends in how students are utilizing higher levels of on-call services or crisis services, universities like ours, that provides more of that. We have increased our crisis team. We have increased flexible options. Not everybody likes to come in person. We've engaged the nation's premier telehealth company to provide services 24/7, just like ours, but that you can get them virtually through Timely Care. But this is a trend across university counseling centers in the country, based on student utilization and desire for increased services, 24/7 services, on-demand, free, confidential services. And if a college or a university is not responsive to that, then it will create a real deficit in what their students are experiencing. And so that concludes our shared discussion. And, we'll give it back to Joel.
Great stuff, folks. We'll have our last presenter, Lincoln. I apologize if I butcher your last name. Anibali? Perfect. I rarely hear that. A class of 2025 president, the Hofstra University Student Government, to speak about their experiences regarding to our topic.
No problem. Oh, here it is. Okay. Great. Hello. Good morning, everyone, or good afternoon now at this point. Thank you to the School of Health Sciences for having this opportunity to discuss all these very important issues. And I have to say, I've been on this is my third panel this week for the Presidential Symposium. On Tuesday, I was with a group of law professionals, yesterday with some higher ed professionals, and today with some medical professionals. And I have to tell you that the way that each profession plans their panels and discussions and the way they meet is very different. So I think next year at our next Presidential Symposium, we have to discuss how all of the different professions plan their topics, because I think there's something worth studying there. But thank you again to the School of Health Sciences for this opportunity. Today I'm going to talk about my work as student government president in receiving a lot of concerns about mental health care on Hofstra's campus, and also working with student governments across the entire state to advocate for mental health legislation last year in the Student Suicide Prevention Act. So the Student Suicide Prevention Act was a project that was began at Stony Brook University, and they adopted a resolution of their student government to lobby their representatives in Albany to support student health counseling and investment from the state, and require schools, private and public, to take on certain responsibilities for their students and their mental health in student suicide prevention particularly. And Hofstra does all of the things that we were asking for to be required across the state. But for some schools, it is too high of a cost to cover mental health services. And it has not always been that way here at Hofstra either. Throughout our history, we have had incidents of students losing their lives to suicide, which is always a tragedy. And it's about how we respond to that as a university community that is important. And we've taken all the right steps to buff up our student counseling and student health services. And part of that is the culture. We are today, like the other panelists discussed, are in a very different culture than where we were 20, 30 years ago in terms of talking about mental health and talking about suicide. Which is a good thing, and we're moving still in the right direction, and we still have a lot of work to go. But on the legislative level, there are so many universities that, as I mentioned, just can't afford mental health care for their students in suicide prevention. And the state currently only requires some provisions for public K through 12 schools. And of course, as we've seen through the data, that these issues of mental health and suicide are coming up through K through 12 into now the university level, which is deeply concerning. And it's important that as a state, we ensure that all of our students across the state are cared for. So this coalition of student governments, Hofstra University Student Government was the first to sign on along with Stony Brook, and we built a coalition of over 50 other universities, student governments across the state, representing over 600,000 students in New York, advocating for this legislation. And when I first received the email from Vignesh Subramanian from Stony Brook, is the student who really got this effort kicked off the ground, I was very passionate about it, but I never thought of myself as a mental health advocate. But reflecting on this and reflecting on the legislation that we had, I realized that there were so many instances in my life when I used mental health services or brought my friends to mental health services to ensure that they are taken care of. And one example is a few years ago here at Hofstra, when a friend called me late at night and they were in a crisis situation, and I went to their dorm, and if it had not been for the crisis services that we have at Hofstra, that student very likely may not be here today. And so that got me to thinking about a student who might not have had that opportunity, who might not have had those services provided. And going back to the Student Suicide Prevention Act, so once the Assembly closed out their session, the bill essentially died, although there's still a lot of momentum. And we never hit any assemblyman, assemblywoman who was opposed to what we were asking for. Everyone from higher education professionals to the students to the people who introduce and vote on the bills were all in support of what we were advocating for. There was no partisan lines, no political faction that was against us. But the thing that always is a barrier is the cost of mental health services. So if the state requires universities cover these things, then that is an additional cost that they will need to cover somehow through grants, applications, or that the university themselves are going to have to cover, which is a huge burden with already skyrocketing costs of tuition and mental health services. So that is where the other part of it was kind of giving it the postmortem of why didn't this make it through beyond just the costs. And it's a question of where do we as a university, where do we as a state, as a society at large, decide to allocate our funds for mental health care. And if, I'm not sure how much specifically that counselor who picked up the phone when my friend and I were in crisis and needed to speak to someone was paid. I'm not sure how much, what percent of tuition, of my tuition that counselor receives and what counseling receives in general. But whatever it is, it was worth it for my friend's life, and their family feels that way. And I know my family would feel that way if I were in their situation. And we as a university community and a broader community feel that way about life, and we value life. And it gets very tricky when we're talking about where we allocate our funds when some amount of money could save lives. And it's very difficult to do because our representatives in Albany need to make that decision as to where do they draw the line, how much do they value students' lives, especially now when so many students, as we've seen in the data that was presented, are struggling with mental health. And suicide is the most destructive end of mental health. It's not always the end, which is, of course, the good thing, and it's not always even a factor in mental health concerns, but it is always a tragedy when it happens. And whatever amount of money we can invest in ensuring that tragedy does not happen again, even if it is one life that is saved, I think that it's worth it. And at Hofstra this year, investing in timely care is a huge step up in that. And so any step we can take to ensure that more universities have that opportunity, whether that be opportunities given by state through funding or through their administration realizing the important potential of investing in mental health services and suicide prevention, the more lives we'll save and the more students will perform better and the more well off we'll be as a community. So thank you very much.
My panelists, I'm going to invite you to the stage. It's properly set for you. We're going to take maybe 10 minutes just for a little group conversation to discuss reactions and whatnot, and then open the floor to our audience members for some Q&A relevant to our topic. I'll wait while you... All right. So I have a question just to open up the conversation a bit, and then given if there's enough time, I do want to save time for Q&A, so maybe about 10 or so minutes here. But I'd like to ask if each of you can speak just from your personal and or professional experiences, if there are existing policies, legislation, as each of you have talked about, bipartisan efforts and different initiatives that have been historical and are ongoing, that exist to enhance mental health services provided to college students. Are there existing policies that guide your work, have guided your work? Directives, examples that you think of personally or professionally that have guided your work in working with college students? Are there opportunities to enhance, perhaps, from your perspective, those initiatives? If so, how? So you can start with anyone, and then perhaps maybe I'll start with the kid. I don't have my glasses. Lincoln, if you can take that one.
Yeah, no problem.
And then we'll go on from there.
Yeah, great. So the legislation that we were basing our advocacy off was the Student Suicide Prevention Act, and I should have been clear in that what we were advocating for were amendments to that legislation, which would have expanded the services, requiring universities to develop certain programs on suicide prevention, requiring private schools in the K through 12 level, and of course universities, and requiring universities to establish crisis centers for students who need it. So a lot of that has already been applied to K through 12 public schools. What we were advocating for was an amendment to extend that. So the Student Suicide Prevention Act, while it's not currently applied to universities, I think is a great place where we can look at to model, and the mental health services provided in high schools in New York and across the country are a great place to start, because there tends to be a lag in the way that students are treated in high school versus they come to university and now everything is different, just in all areas beyond mental health care and healthcare in general. So looking at high schools as a model and how we treat high school students to ensure that they have the accurate and respective care once they come to university.
Solid. Dr. Noble, any thoughts?
So, nationally, as a counseling center director, I speak with other counseling center directors regularly, and there's a national crisis in hiring. It's hard to get personnel. And so we know that the bipartisan legislation that was released earlier this month and that has a lot of support is going to provide scholarships for individuals in the mental health professions that should hopefully really assist mental health as a field, but also counseling centers to provide additional resources. I think that Hofstra is really ahead of the curve in terms of what we provide, because we provide responsive care based on what our students are experiencing and national trends. And like Lincoln was alluding to, all of the things that are in the Student Suicide Prevention Act, we're already doing and we already seek to improve upon every day.
Fantastic. And lastly, Dr. Brader, anything to add or echo?
Well, I guess I would echo that I think the schools have received some support. I would say I scour for government support from a hospital perspective to support college students. I have grant writers that scour, and it's extremely limited what an organization like Northwell can actually receive to support college students. I will tell you our program, which has been touted as a gold standard, and I'd like to tell you I came up with the idea and, in a boardroom and then implemented it, but the reality is I started it as a pilot and found out all the things we were doing wrong between a school and a university and put protocols in place to fix them. And it's expensive, and I've legged my program, and Northwell has been very supportive of mental health to keep this program going. But I do think it would be beneficial to have a program like this in other places in the country. I do know there's a couple feasibility studies going on in other countries. We did present in Singapore last month, but there are a couple of feasibility studies in Massachusetts and in Virginia. But I think that that's a very slow start for what is needed. More locally, I would say one thing that I find as a huge obstacle for student mental health is the police department unions, because when we have colleges that utilize the fire department in Nassau County or the and ambulances come pick students up, we are not allowed to have them go to LIJ to receive the customized services. So one of the things is that we provide our own ambulances that are more quiet and provide a quieter experience and maintain the privacy of the student. Like Nassau Community College could not use our ambulances because of the police union, because the police union has to be utilized at Nassau Community College. So that's something out there. And I think one other legislation that can be very helpful and maybe isn't as direct or is more indirect, but I do think that it's going to be handled differently in colleges, but I do think that there needs to be more looked at with the use of cell phones and our brains and our mental health. There is pretty clear data that says the more you use your cell phone, the lower your mental health will be. There's pretty clear data that's been replicated. Jonathan Haidt, Jean Twenge has reported on it, and I think that that's an area that we're going to see legislation changing in the schools K through 12. And I'm not saying, I'll be very unpopular if I start advocating for no phones at college, but I am saying that it is something we definitely need to think about when we're having a conversation about mental health.
Thank you. Mindful of our time, I just want to ask one more question to our panelists and then move to the Q&A. So folks, I'll invite you again, if there are thoughts or reactions, feelings you have regarding our topic today, to get those ready, top of mind, because we're moving to the Q&A immediately following the responses to this next question. So from your personal and or professional experiences, how do you anticipate election results, particularly in this current climate, impacting the overall well-being of college students here at Hofstra, particularly in terms of stress and or mental health? Dr. Brader, thoughts?
What do I anticipate will happen?
Sure.
I anticipate that there will be disappointment on the campus. I anticipate that there will be higher levels of stress. I anticipate that people are going to be disenfranchised with different political parties, and we see that already. What I hope is that we can lean into what we know we can control versus what we can't control. And that we don't let something that we don't believe is fair or just impede our ability to control what we have control over, meaning going to classes, maintaining our health, taking care of ourselves, being an active part of our own mental health, maybe scrolling very inflammatory rhetoric over and over again. I would recommend watch the news once a day. You're probably going to hear everything you need to hear. Everything else is rumination and repeat. So I would say that would be my biggest challenge, would be I try to do that myself, watch the news once a day. If something really bad is going to happen, my kids will get me. I hope.
Lincoln.
I think that what affects students most during election season and when political divisions are tense, whether it's in an election year or not in an election year, is the reaction on campus and the reaction of the people and the things that direct them, that are impacting them directly. So, if a candidate, whichever candidate wins or loses, some students are going to be upset about it, some students are going to get angry. But if there is a limited reaction on campus and students still feel safe on campus and still feel welcome and feel like they can engage and disagree with each other, then I think there is less stress and less mental health concern. Whereas if students are screaming at each other or chanting or posting about other students or issues, and students see that, and then you see someone walking across the Unispan who just posted something that you feel is hateful or very disagreeable, then you get stressed out. And that's what I think most of the mental health concerns stem from. It's not necessarily the off-campus reaction and effects, which plays a role, but I think the thing that is most pressing is how a campus reacts and how the people who you know react.
Dr. Noble.
And I would echo that. I think that whenever an outcome occurs that we are not fully in control of, and for example, you vote and the candidate that you voted for does not get elected, or you have a stance that you really support and other people really disagree with you, you feel a set of emotions. And a lot of people just say, I feel mad. But if we examine the emotions that we feel a little bit better and say, maybe it's disappointment, maybe I feel powerless, or maybe it makes me think of times in my life previously where I didn't have control. We can recognize the depth of those emotions. As a community, we will feel the impact of all of that when we as individuals reflect before we speak and understand what our emotional reactions are informed by, and then move forward with care for our community, because this is a community. We all belong here, every single one of us, regardless of what we think or feel or what our political affiliations are, our religion, gender, sex, everything. We all belong here, and we all deserve to be here. And when we remember that, and we remember that the control we have ends here, right? It ends with the nose on our face, with the words that we say and what we put out into the world. I think that we do better when we remember that, when we remember that there's something bigger than us that we all belong to here, that we are responsible for taking care of. We all have a role of stewardship in maintaining this beautiful thing that we're building here. So I think that people will experience a variety of negative emotions. and or positive emotions, but recognizing what those were informed by and taking care of those ourselves and then taking care of the rest of our community is really critical.
And I think one more thing that stresses students out is if they feel like their professor or instructor is not agreeable to their opinion, especially in social science discussions in classrooms where maybe you get a bad grade on a paper about a political issue, and you feel like maybe the professor just disagrees with you, and that's why you're getting that. That can be very stressful because going back to the control thing, you lose control with when you can work really hard on a paper, an assignment, and you know that, and if you fail it or get a grade that you weren't expecting, even if it has nothing to do with the professor's beliefs, it can feel like you are being targeted for your viewpoint, and just that feeling alone, or the stress of considering whether or not what you're writing or what you're doing is going to get you in trouble, is stressful.
Thank you.
That's a great point.
I'd like to open up the floor to any questions or comments from those in the audience. Comment for anyone on the panel. If you have something, feel free to walk down to the mic there, kind of center of the room, and pose a question or comment for anyone on the panel. Sure. Kick us off. There's a microphone there, so if you can, yep.
This is really addressed to Dr. Noble.
Yes.
You had mentioned a couple of times that there is not sufficient labor force for you to hire. And one of the quote, solutions to this was to provide scholarships. However, that's not really a good long-term solution to the problem. And I was kind of wondering why you thought there is such a lack of mental health professionals, and what do you really think should be done in order to solve that problem?
So I will say we've just made more hires here because this university really supports mental health care. And I think part of the issue is there needs to be a larger mental health workforce, which I think that providing graduate education is expensive. We know this. So providing scholarships for individuals who might not traditionally be able to access higher level education is really building the workforce and increasing diversity in the mental health workforce. I also think that part of what we see at college counseling centers across the country is that individuals who we could hire are going to other settings like prisons and private practice and hospitals because they pay more. But I can say that universities are really starting to consider that as they prioritize mental health among their student bodies.
Do you think that overall, as we're talking about presidential elections, if there were decisions that were made to raise reimbursement levels overall to providers, that would entice others to go into the field?
I don't know, very honestly. I can't say that I know that. I know that most universities that I know about provide the service for free, and so there's no insurance involved. Across the field, I know many providers who don't take any insurance, not necessarily because of reimbursement levels, but because of the red tape involved
It's awful.
of coping with this.
Yes, it's awful.
However, I think, again, when we approach this as a community and we recognize that we have a role in caring for others, we're encouraged to take on pro bono patients, we're encouraged to provide flexible fees, and I think this is something that we as a community of mental health providers are impacted by because graduate education is so expensive, and there has to be some level of recognition for if you're working for this degree and you're an individual who's out in the field getting reimbursed fee for service, and you want to provide for other people by providing pro bono or reduced fee services, those scholarships, going back to that legislation, that will really help, I think.
Thank you very much.
Sure.
I would like to add one thing to that is about reimbursement, and because we're an institution, a mental health institution, and we take insurance and we also take Medicaid and Medicare. our hospital, our inpatient and our outpatient post-acute program does. I will tell you that commercial pay insurance has improved tremendously on reimbursement. But when you look at, and we do not discriminate against this, we take all Medicaid and Medicare. That is very different to an institution in being able to maintain programs. So the mental health for Medicaid and Medicare is very different than commercial pay.
Other questions from those in our audience? Comments? I do have one question for the panelists, as I'm aware of our time, and you all spoke about strategies in some way, right, regarding universities or colleges. I've kind of localized the conversation a bit to Hofstra specifically recently, so I'm wondering if we can leave perhaps those in attendance with any practical implementation steps that professors or students, faculty, administrators can consider, right, regarding managing or mitigating potential negative impacts that are brought about from this current election cycle. I'll start with Dr. Noble.
Sure. I think that every member of this campus community can talk about how we take care of ourselves through adverse events. And knowing how other people are caring for themselves and encouraging every member of our community to take care of themselves in whatever ways they need to mitigate the impact of disappointment, pain, feelings of loss of control is critical. So for people who have more experience in doing so, talk about, this is how I manage disappointment. This is how I manage my own stress, because you serve as a model. I'm talking to our faculty, I'm talking to our administrators, I'm talking to all our people who are in educative roles. You model what students will do, and the impact of your words is immense. And so if we speak in inflammatory or intolerant ways, if we overfocus or over-identify or define ourselves by a particular viewpoint, this encourages that. And when we talk about how to talk about opposing opinions, when we dive right into dialectics, both ends, and do it respectfully and do it with a thoughtfulness about how we're coping and dealing with ourselves during those times, I think we can model something incredibly effective, and it only contributes to an improved campus community.
So good. Thank you. Lincoln.
I would just say ensuring that there are spaces for students to discuss issues and use their voice and ensure that their voice is heard, and also just ensuring students know what resources we have here for counseling and mental health care.
Very good. Thank you. And lastly, Dr. Brader, anything to add or echo?
I think I would say, and I'll end on this just as the number one predictor of mental health is sense of community. It's the number one predictor of lack of mental health is loneliness. So if we're going to talk about mental health in this climate and in an election, I would say don't isolate, reach out to people, talk, and if you are feeling uncomfortable, reach out to the counseling center and get supports, because those supports are there, and we know that those supports are a buffer to decompensation, because I don't want anybody coming to me. I want them to stop here. And if they do, we're going to take care of them and get them back to you. But I think that it's really important to either reach out to your community and discuss it with your friends and feel like you have supports, or to go to the counseling center, or both.
Thank you to our panelists. As I tell my students, I can talk all night, but we'll
I
keep
think there's one
here.
last question.
Oh, there's one more question?
Yes.
Oh, I'm so sorry. Let's take it. I did not see you.
I wanted to come up here because I think one of the big things that's kind of not being addressed with all this is that mental health is being looked at from people are having their own crises, and so they need mental health help, but it's not being viewed in a wider scope that it's a top-down effect. I have known multiple people on this campus who have had to either seek institutionalization or have had to drop out of the school entirely because of how traumatized they have been from the mishandling of their own personal Title IX cases. That is a really big issue that this school has that's not being addressed because it's seen as a separate thing. It's, oh, you were traumatized by this event that happened to you, but the fact that they're being traumatized not only by the events that are happening to them, but also by the institution's mishandling of the cases that they're bringing to the school is something that's not being addressed. I had 2 friends who used to go to this school. They were here last year. One of them was in their 3rd semester. One of them was in her 2nd semester. And after last year, after last spring, both of them left this institution because of how traumatized they were at the mishandling of both of their Title IX cases. I have had a 3rd friend who was institutionalized and spent 1 to 2 weeks in a acute mental health facility because she was traumatized after she was assaulted on campus, and the school did nothing to help her and instead kept her assaulter on campus and rewarded him.
Well, I'll say I appreciate your comment, and I find it very moving in the moment. I'm afraid that we don't have a lot of time in the moment to really unpack some of the particulars of that experience, those experiences, but would love to open up, should the panelists feel comfortable, to comment on that from their perspective or a professional, personal viewpoint.
So I'm unaware of those situations, and I am so sorry that you and your friends experienced anything like that. What I can say is that Title IX often works hand in hand with student counseling services to provide support to students who choose to have it. We will never force it upon a student who's been through an experience where they feel like their control has been taken away. And so Title IX is actually located across the hall from student counseling services and is always offered as a resource. But again, we can't make people, accept a resource that they don't want to at the moment. And it pains me greatly to know that anybody goes through what you described. And we are here to support and assist in those situations should individuals choose to avail themselves of us.
Yeah, I'll echo that and just say that I think there are always issues with accountability, and Title IX concerns are at the top of that list, and we want to ensure that every student is heard and that everyone is accountable in the situation. And so we can chat after if you're open to that, and I'd love to hear more so that we can ensure that any situation going forward is remedied.
Well, thank you for that comment, and thanks again to our presenters, folks, and panelists. Give yourselves a round of applause. This concludes, folks, our talk for today. Thank you for attending, and travel safely.